therefore reducing, with the vagal nerve, you like calm down, like everything reduces everything. You stimulate that nerve. Now, for your own knowledge, because it doesn't say it here in the book, and right, so it's not nothing like that. For your own knowledge, some of these are also activated by the nurse. So while it can say intermittent, it may or may not. There's also a way to kind of activate it, and generally that means you have another piece. It's usually like a magnet, and what you do is you place it over their chest here, and then you go over the device like this. And this going over the device with the magnet will activate it, and it gives the signal, right, like to the vagal nerve to hopefully calm it down. It doesn't always work. I know because I've tried it. Like we used to have a patient and he wouldn't stop. So sometimes you have to give him diazepam, and that you can give as a suppository. It works a lot faster. So there's tubes like yay, pre-prep, and if the your patient has seizures a lot, like I was a patient that used to have a lot of seizures. You know you have them ready, and you can do when they're having a seizure, you do suppository and inject like a gel. They absorb it, the diazepam, and that should stop them from seizing. Yes? Yeah. Okay. That's the one that I need you to know, the vagal nerve stimulator. The surgeries a nurse is going to ask you about, but go to your nursing actions. So you'll see that it says, reinforce the client about seizure management, take their medication, and then remind them that maybe they shouldn't drive. In a lot of states, they don't allow them to drive because they can have a seizure during driving. The person not operate like heavy machinery, stuff like that. And then it doesn't say it on here, but there's 3 things that you should have as emergency equipment for them at bedside. They sometimes ask you, what should you have at bedside for this? What are the 3? Suction. Cool. It's not 3 suctions, it's cool. Oxygen.
Something for the airway afterwards?
Oral airway. They ask you what equipment you have on bedside, that's it. Either they tell you which ones, or if they only have one of them on there, these are the 3 options. Okay, and then let's go to the complications in the back. The one that I need you to know is status epilepticus. Okay, status epilepticus. And this is a repeated seizure activity within a 30-minute time frame. So repetitive seizures, one right after the other, within 30 minutes, or a single seizure that lasts more than 5 minutes. So just non-stop seizure. The complications associated with this are related to decreased oxygen levels and the inability of the brain to return to normal function after the assault on the tissue. This acute condition requires immediate treatment to prevent permanent loss of brain function and death. So essentially they're seizing for so long that periods of apnea, their oxygen goes down. And this hypoxia is what causes a lot of that permanent damage, not so much a seizure, but the hypoxia, although the seizure activity can also trigger it. So I need you to also know that the usual cause for this, like these can include, substance withdrawal. It's similar to those seizures. Substance withdrawal. Again, stopping suddenly your AEDs, your medication. Head injury. Cerebral edema, infection. So very similar to seizures in general, but I find that it's fair to point out the list of what they call status epilepticus. So what do we do? Nursing actions, like we said, airway. You gotta provide an airway, give them oxygen, start an IV, make sure that there's access. Okay, and then EKG for their heart. Not ECG. Not EEG, sorry, ECG for their heart. Now, what are we gonna give them? It says the medications there of choice. They're gonna receive diazepam, lorazepam, midazolam, or diazepam rectally, right? So it's your labs and PAMs. What are they receiving? Benzos.
Benzo.
Diazepam is the one of choice usually. Good?
Mr. Armando, the type of epilepsy, would that be, I mean, the seizures, would it be a grand mal seizure or just
For what?
for the status epilepticus?
It's not specific. It's just the fact that you're having, for that time frame. But generally, it's grand mal or tonics. So there's a few problems with this to begin with. And it's nothing that you're asking, I think it's relevant to whether it is or pregnancy, with the exception of that when we go over an OB, you'll realize that a lot of anti-epileptic drugs are not safe to take during pregnancy. So generally, if you have a history of seizures like that, you're probably not even gonna get pregnant. Then you're risking your seizures versus your baby. Because it's like, do you take the meds? And some of them you can't, you're gonna harm the fetus for sure. Some of them are known teratogenics, so you'll probably switch meds. So again, it's like you're trying to manage seizures while trying to have a baby. I'm not saying you can't, but there's a lot of risk involved because you have epilepsy, you get seizures. That's what I'm saying. So if then you don't have epilepsy, you had a seizure, but you don't. That's what I'm saying. You can just have a seizure, so you don't have epilepsy. You're answering it then and there. It's like it's not a recurring thing, and arguably you know what caused it. Like you either hit your head, or again you had a near drowning experience, or after a car crash you have severe stress. Like there's something like that.
No explanation. It's not like something happened that caused it, but it's not strong.
So it could be unspecified, but even if you know something's causing it, you're still developing epilepsy. You just know what triggers it. But that's why you have epilepsy. You have something that's currently triggering it and recurring it. So whether it's triggered or not does not mean it's not or is epilepsy. Epilepsy is just two or more.
Just hit your head, have a seizure.
You have one. Difference between 1 and 2, bro. It's not like just 2 or more.
No, with the pipes on this thing, that's why.
Are we good? Please remember emergency equipment. You have to define the seizures and the safety for it. I think is the most prominent. Good?